This is Mary. Mary is pregnant with her first child. She has a family history of cerebral palsy, so today she is visiting her doctor to ask him about the possibility of her child being predisposed to the disease. Mary undergoes a series of genetic testing to identify any possible markers for cerebral palsy. This video is a public service announcement to raise awareness for cerebral palsy. It is very important for expecting individuals with a family history of cerebral palsy to take precautions in getting tested for genetic markers. Cerebral palsy was first proposed as a movement disorder by the father of psychoanalysis, Sigmund Freud, in the late 1800s. He suggested the idea that cerebral palsy might result from abnormal fetal development, long before the medical field embraced this concept.
Cerebral palsy is a neurological disorder that permanently affects movement, muscle tone, and motor skills. The disorder is one of the most common congenital disorders, affecting about 500,000 children in the United States. Cerebral palsy identifies as three types based on the origin and source of cerebral damage: spastic, ataxic, and athetoid.
Spastic cerebral palsy, the most common, is described by lesions to the corticospinal and corticobulbar tracts. These are important for relaying signals from the brain to the spinal cord. This is also very important for voluntary muscle movement as well as neural control of cranial nerves. Spastic hemiplegia typically affects the arm and hand on one side of the body, but it can also include the leg. The arm and leg of the affected side are frequently shorter and thinner. Some children will develop an abnormal curvature of the spine. A child with spastic hemiplegia may also have seizures, speech with delayed, and at best may be competent but intelligent is usually normal.
Athetoid cerebral palsy, or dyskinetic cerebral palsy, is caused by lesions to the basal ganglia, which regulates voluntary movement by relaying messages from the motor cortex and the spinal cord. It is characterized by slow and uncontrollable writhing or jerky movements of the hands, feet, arms, or legs. Hyperactivity in the muscles of the face and tongue makes some children grimace or drool. They find it difficult to sit straight or walk. Some children have problems hearing, controlling their breathing, and/or coordinating the muscle movements required for speaking. Other conditions associated with cerebral palsy include intellectual disabilities, seizure disorders, delayed growth and development, spinal deformities and osteoarthritis, impaired vision, hearing loss, speech and language disorders, drooling, abnormal sensations and perceptions, learning difficulties, infections and long-term illnesses, contractures, malnutrition, dental problems, and inactivity.
Ataxic cerebral palsy is the least common and is caused by damage to the cerebellum, which is responsible for the fine-tuning of movement. Ataxic cerebral palsy affects balance and depth perception. Children with ataxic cerebral palsy will often have poor coordination and walk unsteadily with a wide-based gait. They have difficulty with quick or precise movements, such as writing or buttoning a shirt, or having a hard time controlling voluntary movement, such as reaching for a book. Mixed types of cerebral palsy refer to symptoms that don't correspond to any single type of cerebral palsy, but are a mix of types. For example, a child with mixed cerebral palsy may have some muscles that are too tight and others that are too relaxed, creating a mix of stiffness and floppiness.
Unfortunately, the direct causes of cerebral palsy are currently unknown. However, certain events that occur during fetal development may contribute to cerebellar damage. Individuals with cerebral palsy are due to premature birth, where the newborn is less than 3.3 pounds, which may cause brain damage. Other causes may include low levels of oxygen leading to hypoxia and prenatal infections that may lead to genetic mutations, which can be viral or bacterial.
Hi, my name is Ikram. I'm a doctor at Sick Kids Hospital who works with children with severe neurological disorders. Unfortunately, there is no cure for cerebral palsy, as there may be an underlying genetic factor that predisposes patients to cerebral palsy. Pregnant women, as well as their partners, are encouraged to undergo genome sequencing. This may help identify specific markers that have been associated with cerebral palsy. Regular checkups via ultrasounds are also definitely helpful to track the progression of the pregnancy, as well as prevent any damage to the fetus. However, therapeutic treatments are available for patients with cerebral palsy. Specifically, physiotherapy helps patients develop motor skills that are required for daily activities.
Hi, I'm Vivian Kong, a researcher at the Western Laboratories, looking into the causes and treatments for cerebral palsy. Our lab is actually currently looking into the genes that cause cerebral palsy, and typically these genes are associated with the neural migrations, where the neurons actually settle after development. So by understanding where the neurons go and how they make connections, we can potentially solve any sort of development problems prenatally, after birth, potentially even after that, hopefully. So our other laboratories are actually researching in how neurons specialize and form the correct connections in the body. So in a similar fashion, by understanding this, we could potentially prevent problems in brain development. We understand that brain damage after birth can cause cerebral palsy. So we want to try to understand how seizures, circulation problems, abnormal chemical concentrations, and other sort of problems that could occur to cause brain damage can affect the newborn's brain. And so we could potentially have a better understanding how cerebral palsy is formed and what effects certain chemicals may have specifically. And so we hope that by combining all of our efforts, we can have a successful treatment for this disease in the near future.